are now live.
So thanks everybody who's joined us so far. We're going to wait another minute or so because people are slowly trickling into our virtual space here.
For those of you who are on time, and we'll say this again once we start, the reason that there's a slide is so there can be closed captioning. And so the slides are not going to change. Don't feel like you're missing anything if it's that same picture the whole time. And the closed captioning is not perfect, but it is better than not having closed captioning.
For those who have joined us, we'll wait just about another minute. People continue to get in from the waiting room.
Simon, if you're there,
Yes.
the sharing went away.
No, it's still there.
Okay,
Oh.
for some,
Can you try resharing?
yeah, I'm gonna stop share and then reshare.
Right. Shall we start, Professor Hirsch?
Yeah, let's start.
Okay. Welcome to Sexual Citizens, a landmark study of sex, power, and assault on campus. I am Diane Hassling, class of 79, chair of the Princeton Women's Network of the Princeton area. A few weeks ago, Professor Hirsch reached out to me to see if our PWN would be interested in having her join us for a talk about her recent book. With the help of Tom Swift, president of the Princeton Area Alumni Association, and Arlen Hastings, past president and book club chair of PA3, we've been able to sponsor this open event at reunions and bring this important issue to a wider audience. I have the honor of introducing our panelists. Professor Jennifer Hirsch, 88, is a professor of Sociomedical Sciences at Columbia's Mailman School of Public Health and co-author with Shamus Khan of the recent book, Sexual Citizens, a Landmark Study of Sex, Power, and Assault on Campus, published by WW Norton. That work was realized as part of Columbia's Sexual Health Initiative to Foster Transformation, or SHIFT, co-directed by Jennifer and clinical psychologist Claude Ann Mellins. Some of you may recall seeing SHIFT profiled by Jia Tolentino in the New Yorker in February of 2018. Jennifer was in residence here at Princeton as a visiting research scholar at the Center of Health and Wellbeing in 2018 to 19. A good portion of the book was written in her office overlooking the Wilson School Plaza, and several chapters were workshopped in conversations with Princeton faculty. A recent review in Science describes Sexual Citizens as profoundly eye-opening, and we are delighted to welcome Jennifer to Reunions to talk about her work and about what all of us as community members, young people, parents, and voters can do to prevent it. Elizabeth Mitchell Armstrong, star 93, is Associate Professor of Sociology and Public Affairs at Princeton, where she is also a faculty associate at the Office of Population Research, the program in Gender and Sexuality Studies, the program in the History of Science, and the Center for Health and Wellbeing. She is a graduate alumna of Princeton. She is trained as a medical sociologist and demographer. She has research interest in the history and sociology of medicine, reproduction, particularly pregnancy and childbirth, gender, public health, and medical ethics. She is the author of Conceiving Risk, Bearing Responsibility, Fetal Alcohol Syndrome and the Diagnosis of Moral Disorder, Johns Hopkins University Press, 2003, the first book to explore fetal alcohol syndrome from a sociocultural perspective and to challenge conventional wisdom about drinking during pregnancy. She has also published on mass media, attention to disease, medical mistakes, contraceptive decision-making, adolescent motherhood, prenatal substance use, home birth, and the sociology of pregnancy and birth. She teaches classes in culture and reproduction, maternal and child health policy, medical sociology, and research ethics. Armstrong was recently appointed the next head of Butler College. Mary DeVillis is a rising senior at Princeton University in the Department of Anthropology, Global Health Policy, and Gender and Sexuality Studies. Last spring, she took Professor Hirsch's course on gender and public health and has worked with Professor Armstrong on a variety of projects, both in academia and advocacy. Mary is the former co-president of Princeton Students for Reproductive Justice and a current member of Princeton's new committee on sexual climate, culture, and conduct that will work with Dr. Hirsch and Dr. Khan this summer. Welcome everyone to our panel.
Thank you, Diane, and thank you to the Princeton Area Alumni Association for sponsoring this Reunions event. Welcome to all who have joined us. Those of us who are here in Princeton are very sorry that you're not with us on campus right now, but we're delighted that you're with us in our virtual space. Before we begin, it's important to note that our discussion of sexual citizens will contain descriptions of actual sexual assaults as students experienced them. This material can be hard to listen to, and we know that in every room, virtual or not, there are survivors. We'll drop the RAIN hotline number in the chat window, as well as some contact information for SHARE if you're a Princeton University student. Please take care of yourselves and know that you are not alone. Jennifer, thank you so much for joining us this afternoon. We're all really excited to talk about this very important work. I'd like to start by asking you why you wrote this book.
Thank you for, I just want to, before I answer the question, I just want to thank Diane, the Princeton Area Alumni Association, you, Betsy, Mary, for bringing us together in this virtual space. I'm so excited to share this work, which in many ways dates back to my time as an undergraduate at Princeton in terms of thinking about these questions. So it's really, it's both an honor and a thrill to be here. In 2014, as I was observing the national conversation about campus sexual assault, it was a moment where there was a lot of interest. The film The Hunting Ground had just come out. There was a multi-campus survey effort to measure the prevalence of campus sexual assault. And it seemed to me, from my vantage point of several decades of work on gender sexuality and public health, that something was missing, that the conversation was focused on the problem of predators, people who intentionally harm their peers, which does exist, or what to do after assaults happen. And yet we know that only a minute proportion of assaults are ever reported and brought forward for formal adjudication. And so it seemed to me like there was a giant hole in the conversation about prevention. So I'll tell you a story to sort of illustrate the potential of thinking differently. Austin was a sweet young man as we knew him through the field work, which I'll describe in a minute, and in his interview. The only really steamy sex scene in the book, which I am not going to describe right now, is an evening of Austin and his girlfriend on a hot summer night when I think you could say they made their own fireworks. And he was a good boyfriend. He had developed a series of nicknames for the kinds of orgasms that his girlfriend had. So he really tried to be not just a nice person, but a good lover. And yet in the interview, he recounted to us a time that he sexually assaulted someone. It was freshman year, the first couple weeks of school, and his roommate already had a girlfriend. And in an effort to find some private space with the girlfriend, he sent Austin off to the girlfriend's room, where the girlfriend's roommate was drunk and lying in her bed. And Austin came into the room and she mumbled to him, she wasn't really interested in doing anything. Of course, like as if you should have to tell someone that when you're drunk in your bed, that it would be even a question that something would happen when they're not a stranger, but not an intimate partner. And yet he got in bed with her, and having been told that she was not interested, and started to touch her body. And then he stopped himself. So what he did was an assault. He had never called it that. He became distraught in the interview. He told us the story, and then later in the interview, we asked him what a sexual assault was. And he said, well, it's when you touch someone sexually without them agreeing. And then he paused, and you'll excuse my words, but this is what he said. He paused and his eyes filled up with tears, and he said, fuck me. Because like in that moment, he was shattered by the realization that he had done something that he knew was wrong. And so the question we ask in Sexual Citizens is, how can we build a world in which people not only know not to do that, but actually don't do it? So the research was part, as Diane mentioned, of a much bigger project, the Sexual Health Initiative to Foster Transformation, which was funded by Columbia, and I co-directed with Claude Ann Mellins. It was a giant sort of moonshot level project that involved ethnography, which I can describe more about in a minute, 2 kinds of survey research, and a long conversation with the university about what our findings meant. Because most research, I hope everyone is sitting down when I say this, most research has no impact on policy, right? People just like generate information and then it does nothing. And we didn't want to do all this work and have it not make any change at Columbia. And so from the beginning, we were in dialogue with both students and with the administration about the implications of our work. And so there's sort of 3 big points that we make in Sexual Citizens. The first, as I said, is about prevention. But when we mean prevention, we don't just mean prevention like Princeton's SHARE program or Columbia's sexual violence response. We mean prevention as in everyone has a role to play in prevention. The sexual assault on campus is not just a higher education problem, it's a social problem, which means there's something that all of us can do to prevent it. And then the other big point is about power. It feels almost absurd to have to say this, but you can't, you know, 5 decades of research on sexual assault, but you can't think about and you can't begin to prevent sexual assault without thinking about power and how power intersects with sex, but not just gender power. In the book, we tell stories of queer assaults, and we tell stories of women assaulting men, and we tell stories of assaults that can really only be understood through a framework of racial inequality. And so building on the feminist analyses that have become sort of standard in the field, in Sexual Citizens, we look at how social advantage intersects with all different kinds of situationally variable power to produce situations in which assaults are likely to happen. And before I turn the microphone back over to Betsy, I just want to note for those of you who've recently joined us about the closed captioning, which is on the top of your screen. It's imperfect, but better than no closed captioning. And it works through Google Slides. And so don't expect the slides to advance. There are no slides. That's just a placeholder so that you can have words along with listening.
And I also wanted to let people know that you can drop a question into the Q&A at any time. We have our question curator, Mary DeVellis, who's going to help curate those questions for us. And we'll have an open Q&A a little bit later on. But you can feel free to drop a question in there at any point. Jennifer, I have spent a lot of time on college campuses, both as a student and as a faculty member. But I really felt that reading your book revealed aspects of college life to me that I had never really appreciated before. And reading your book, it's filled with personal stories of students about college life in general. It gives us a really intimate portrait of what it is to be a college student today. Can you talk to us a little bit more about how you were able to put together these portraits and the research that went into the book?
So the Sexual Citizens does, as you say, pull back the curtain on what it's like to be a college student at a residential institution today. And part of what distinguishes the work is the ways in which our research team spent time alongside students in the day-to-day. So Shamus and I are too old and we go to bed too early to spend time socializing with students. And plus that would be super creepy, right? To like go to a party and there's your professor lurking, you know, what a buzzkill. And so we hired 5 younger researchers trained in social science or public health. They always identified themselves as researchers. This is the thing I think that most frequently people misunderstand about the research methods. They weren't spying, they were embedded. And so through our undergraduate advisory board, they developed connections to undergraduates across the campus throughout Columbia and Barnard. And they spent time hanging out with them. So riding the bus up to the athletic fields, in the cafeteria, at parties, in religious spaces. So the immersion comes from the field notes of our research team, who frequently worked until 3 and 4 in the morning on weekends, hanging out in ways that were sort of sometimes fun for them that Shamus and I just would not have been able to do. We complemented that with interviews with 151 students who were selected intentionally to represent the diversity of the Columbia and Barnard student bodies. Each interview was about 2 hours, but some students had experienced so many assaults that they came back a second time or even a third time to tell us their stories. Some of those 151 students were students that we recruited into the study to try to reflect the diversity of the student body, and others were students who approached us. Sometimes in response, there was an anonymous email that went out to all the undergraduates about the survey part of SHIFT. And there were students who wrote back in response to that anonymous email and said, I have a story to tell. And they were so hungry to share their stories back with the university in a way that would shape policy. They saw it as a social responsibility. I will never forget one young woman who gripped the arms of her chair and looked me in the eye and said, "I want you to tell my story to Lee Bollinger, who's the president of Columbia." So I think that students saw this as an opportunity to have their suffering shape the experiences of future students. So that was the data collection. In addition, we ran focus groups, which is an interesting way to hear how students talk about sex when they're with each other. And the result is that we look at sexual assault in relation to students' lives as whole people. We didn't want to study sexual assault in isolation, but instead explain how it's a predictable part of the lives of students and look at it in relation to sex. But so the troubling insight that sexual assault is a predictable part of the college experience for so many students, which is that we can make it less so through prevention. If you think about traffic accidents, right? We've made enormous progress in America on making teenage driving safer. That's because we have a whole system that does that. Young people get driver's ed and their parents practice driving with them. I mean, I wouldn't want this to be an exact parallel to sex, but they get there are a lot of systems in place to make sure that when a young person grabs the keys, their parent doesn't just say like, "I hope they're safe," even if they're drunk, right? So, and if you think about all of the efforts that parents put into so many other things that young people learn to do with their bodies. Think about oral hygiene. Think about standing over your kid every night. Did you brush? Did you floss? I lost the flossing battle, right? So like, I'm not claiming to be a perfect parent here, but there is no parallel system for driving instruction in terms of sex, right? We spend so much time teaching our kids to ride a bike or teaching them to floss their teeth, but there's a sort of a vacuum in terms of the teaching that would go into the values formation around sex. So rather than judge Austin and say, he's a terrible person, we say, he did a harmful thing. And what could have prevented him from doing that? Think about the community that he grew up in. Think about his parents. Think about the messages that he didn't get that could have prevented that from happening.
So Jennifer, you've mentioned parents and parenting several times so far in our conversation, and I have to say, this book was both really hard to read as the parent of an adolescent daughter and a preteen son, and also incredibly important. And I know you yourself are a parent. You have a son who will be coming to Princeton next year, and you have a son who's graduating from the University of Chicago this spring. So talk to us a little bit about how you wrote this book for parents, and also who else needs to read this book. It's clear to me, having read it as a parent, that every parent needs to read this book, but who else needs to read this book?
So I think young people themselves need to read this book. You know, our dream is that young people read it in conversation with their parents. I think not all young people, or not all parents, are really comfortable talking about personal experiences, but there are, you know, so many case studies that can be used. I had a fairly heated debate with my sons the other night. There's a story in the book about a young woman who's involved in an ongoing hookup, and you know, he would like text her, you know, "you up," and she would send him a little message, and he'd stop by her dorm at night, and they were like sex buddies. It was not a committed, mutually exclusive relationship, but they liked each other. And then he crossed the line because he told her how sad he was that his grandmother died, and she was down for sex, but she was not down for feelings, and that was it. She ghosted him. And one son said, "Highly relatable content." And the other son said, "That is terrible," and was like horrified that one person would treat another person like that. And so I feel like, you know, I mean, I've been talking with my kids about sex since they were little, because we are the sex ed family, but I feel like there are stories in the book that open the door for families who haven't been having those conversations all along. So for parents, for young people, I think for higher education, there are a series of messages about what we could be doing better. And I mean, Shamus always says, other people don't need to be wrong for us to be right. And so the point is not, and our work was not an evaluation of the existing prevention programs at Columbia. Instead, it was sort of a reimagining in a much more ambitious way of what prevention could look like. So I think, you know, consent education, no question, it's important. In many states, it's also the law. But in the same way that you couldn't teach someone to drive by just showing them what stop signs are and making sure that they recognize stop signs. I mean, when you drive, it is important to know that that red octagonal thing is a stop sign. But if that's all you know, you could still crash, right? Even if you know about stop signs and traffic lights, it's still not enough. And so thinking about the real complexity of sex as an interpersonal interaction, acknowledging that is something that if colleges can't do, needs to happen earlier. So I think they're thinking about expanding out what prevention might look like. I think for a lot of students, given the very uneven sex education that they've had before college, that session on consent education, it's like getting calculus when you don't even know how to add, right? And so I think acknowledging the sexual illiteracy that we've produced in America through intentional policy choices. And then in the book, we're very clear that sexual assault is not one thing. I mean, that's why the whole first chapter lays out such a broad diversity of kinds of assault experiences, because there's not going to be one program or one curriculum or one policy change that is going to prevent it. So the book is written for many audiences.
So one of the things that I especially appreciated about the book, and I'll just put on my sociology nerd hat here for a minute, is that you have these three big concepts, three big ideas that you organize the book around. The idea of sexual citizenship, the idea of sexual projects, and the idea of sexual geographies. These are the lenses through which you make sense, you and Shamus make sense of sexual assault in the book. Can you talk to us a little bit about those lenses, and also what do you hope will be the big take home from reading the book?
Yeah, so I'll give you a sentence or two about each and then tell you a story that illustrates them. And then we can talk about take home. So sexual citizenship is the idea that people have the right to say yes and the right to say no to sexual experiences, and that they need to understand that other people around them have those same rights. So everyone is a sexual citizen. Or we can make policies that can lift up and enable a feeling of sexual citizen in young people. Sexual projects answers a question of what sex is for, which you might think is like a question that only a social scientist would ask, because we know what sex is for, right? It like is for making babies and feeling good, except the college students we spoke with were not making babies. And for a lot of them, sex didn't feel very good. Mm-hmm. And so then, you know, so we look in the book at the other things that people are trying to accomplish through sex, whether it's, as in the case of Austin, just accruing experience, or doing things to impress other people, or trying to figure out who you are. There are a lot of different complicated reasons that people have sex. And by understanding those reasons, we can think in a different way about what prevention will look like. And then sexual geographies is the ways in which space shapes sexual interactions. So think, for example, of a college, a dorm bedroom, right? When you go back to a dorm room, there are 4 pieces of furniture. There's a dresser, there is a desk, there's a desk chair, and a bed. And so pretty much if you go back to someone's room with them, you have to sit on the bed. And a bed has a sexual meaning. And it doesn't mean that if you sit on the bed, you want to have sex, but that moment of sitting on the bed is easily misinterpreted. And so one answer to that is to say to young people, don't go back to their room. But we're not into fear. We're into empathy and self-determination. And we're also into changing the environment. And so an implication of thinking about those sexual geographies is to think about what is the power that campuses have to build new geographies, to create new spaces, where young people can socialize. Something as uncomplicated as making sure that dorm lounges have couches and not just individual armchairs, then changes the way that people can socialize in that space. So, I'll tell you a story. This is in some ways the story, it's sort of the prototypical assault story that people think of when they think of a college sexual assault. Lucy was a freshman and she'd gone to boarding school. She had worked hard to get into Columbia, had not spent a lot of time socializing. So she was excited to have a different kind of experience on campus. She wanted to party, she wanted to lose her virginity. She and her friend Nancy went out to a bar in Morningside Heights during orientation week. It's, they were 18, but it's very easy to get into a bar if you're a young woman. And they met a couple of seniors. One of the seniors bought them drinks, and Lucy was delighted. She was flattered. This was like what she had imagined college would be like, what she had hoped for. Scott invited her back to his fraternity. So they stumbled up Amsterdam Avenue in the warm summer night. Her phone rang and rang because Nancy had that orientation week bystander training and she wanted to keep track of her friend. And so they waited at the fraternity for Nancy to catch up. And then they walked up the stairs and into the building where Scott was surrounded by people he knew who were his friends. Then he asked the girls, because that's what men call young women on campus, is girls. So he asked the girls if they would like drinks. And of course the alcohol is on the second floor because you're not allowed to have hard alcohol in a fraternity. And so the solution to that is to keep it a place where people can't find it. And so it was up in a closet on the second floor. And so he made the girls drinks. Nancy, took a sip and passed out. And then he asked Lucy if she wanted to go up to his room. And she did. So she went up to his room. They made out a little bit, but then he started to unbutton her pants. And she said, "No, don't." To which he said, "It's okay." And and every time I tell the story, it's awful, right? Because it wasn't okay. He assaulted her. I mean, he raped her. It was her first, and she had been a virgin. It was, and then she never told anyone. She hadn't told anyone the story until she told us, because she told her friends as if it were just like a crazy night, because she was embarrassed. She felt like it was her fault. So there's one take on that story in which all we do is think that Scott is a terrible person, right? And we sit in judgment on him and we feel compassion and wish healing for Lucy. And that is, I think it's a very natural response, but it's not a socially transformational response, because if all you think about is people's individual moral brokenness, it doesn't necessarily give you a solution. So we think about that and we think about, okay, there's that space. If we didn't have campuses organized so that freshmen couldn't have their own parties, right? That's a choice that young women feel impelled into spaces to meet older men because of the combination of the organization of alcohol and the fact that younger students generally don't have access to space where you can host a party. They have suites or shared rooms. And so the sexual geography was part of the context of vulnerability. But so was the question of sexual citizenship. When she said no to Scott, he didn't see her as a person. If he had seen her as an equivalent person with a right to sexual self-determination, her no would have been heard by him. But instead, I mean, we can't know what his sexual project was because we didn't interview him. But I think it's safe to say that it was not seeing her as an equivalent person or being attentive to her pleasure and experience. He was using her as an object, right, for his pleasure. And so a sexual project where you treat the other person like an object, a sexual project where you treat the other person like an object doesn't necessarily mean that you'll always assault somebody, but it does increase the possibility because you're essentially using them as sort of like a human sexual scratching post. Now, I mean, as a researcher, we're not judgy about sexual projects. As a mom, I certainly am. But I think the conversation that we, as parents, as members of faith communities, that we can be having with young people is, what is the what is the role of other people in sex? How do you have to see, what does it mean to see their humanity? What is right, where right is not being moralistic about the kinds of partners people have or the kinds of acts they do with those partners, but it's about what people owe each other as members of a society.
I have to say, one of the things that I really appreciated about the book, just picking up on this, what do we owe each other question, was how much emphasis you put on empathy as a value important for thinking about how to prevent sexual assault. I'm wondering, Jennifer, what other surprises there were for you in doing this research?
I think there are two things that were surprising. I mean, many things that were surprising. It was hard for us to see how many of the students who assaulted other people thought that they were having sex. Now, I mean, I think it's important to articulate that the people who are not going to sign up to come in and tell their story in a research project on sexual assault are people who are intentionally preying upon their peers, right? So there are some forms of experience that are only represented by the person who experienced them. But one of the things that's unusual about the book is that we do have the voices and, as a social scientist would say, the subjectivity of the assaulters represented. And, you know, Eddie, for example, started out his story by saying, I put on a tie, so I knew I was going to have sex. And then he recounted this story where he really seemed to feel aggrieved, as if he had been put in a position where he had to do something that he didn't want to do. He was invited to a sorority formal. He wasn't super into the girl, but it was a very prestigious sorority. So it was a win for him and for his team to go. He was in season, he had an early practice, so he wasn't drinking. And as the night went on, she drank a lot. It was pouring down rain. He didn't really know what to do with how to like bring the evening to an end. And so she ended up, he brought her back to his room because he felt like that was sort of what he had to do. And then he recounted to us, and these were his words, having sex with her as she went in and out of consciousness, which is an assault, right? And like cognitively, Eddie had that same prevention education that everybody else gets, but students think that when you go to formals with someone, unless you go explicitly as friends, that you owe them sex. And so he felt like he owed her sex and somehow was thinking about sex as something to have rather than something to share. And so he didn't really notice. The most charitable interpretation is that he didn't notice that she was in no condition to consent, right? And I think he wouldn't have told us, if he thought of it as an assault, it's unlikely that he would have told us the story. So I think that we try to hold everyone with compassion in the way they told us their story, because we have failed them. We as a society, that I think that certainly there are people who intentionally harm other people, but the stories that we heard seemed to be to such an enormous extent produced by a social failure, as opposed, or in addition to bad choices that individuals make. And so, and I think that's what we do. I mean, this is what you also do, Betsy, as a social scientist, right? We explain health outcomes by looking at the context and the society and focusing less on the individual choices that people make. So I think that that's one thing that's surprising. And then another, I feel like, particularly like in this awful moment that we're living right now in America, it's important to lift this up, the racial dimensions of sexual assault. And I mean, you can't talk about sexual assault in America without thinking about race. If you think about the history of slavery, if you have seen To Kill a Mockingbird, if you know about lynching, like there are so many ways in which sexual assault for centuries has intersected with sexual violence. And you know, every single Black woman that we spoke with in the ethnography had experienced unwanted, non-consensual sexual touching. And I always feel like that bears repeating, every single one. And you can't understand those transgressions of their bodily autonomy within a framework of consent, right? That's about racial disrespect. It's about other people feeling entitled to Black bodies. And men also, Black men also recounted to us stories of women grabbing their genitals in bars. And so I think that the intensity of the racial disrespect that Black people experience day in and day out is also manifested in sexual assault. We saw that also in how Black men recounted their consent practices. So one young man who we call Carl in the book, obviously all the names are pseudonyms, he said he never had sex with girls when they were drunk because it felt too dangerous to him. And so he recounted a story one night of a girl who seemed interested in him, and to him she seemed drunk and then therefore not safe. And so they walked around campus for hours until she was, to his mind, less drunk. And then they went back to his room and he still didn't really feel comfortable. He felt like it was too risky. And so they talked some more, and then eventually they had sex. And then afterwards, he recorded her saying that she'd had a good time. And as he recounted in the interview, he had done his homework. He knew that New York is a one-party consent state in terms of recordings being admitted as evidence in a court of law. And so he knew that would work to protect him. But what's really heartbreaking is that he felt that he had to be protected. So I think that you can't, the precarity that he experienced as a sexual person is inseparable from the precarity that Black men experience every day in America. So I think that, we didn't set out to write a book about race, but racial inequality is threaded all through the book, including in the discussion of heavy drinking as a sort of unacknowledged practice of white masculinity.
Let me actually focus on the question of drinking and its connection with sexual assault, because I think we often think about drinking as kind of a precursor or it increases the likelihood of sexual assault happening. But one of the things that you show us in the book is that students are actually using alcohol and drinking because they intend to have sex, not to be sexually assaulted. But it's a really important ingredient of their preparation for a sexual encounter. So how do we think about the role of alcohol on campuses, and how do we make the kind of conversation about drinking on campuses go beyond the sort of don't drink so you don't get assaulted message, which is far too simplistic?
I mean, many students, and I would say in particular white students who tend to drink more than Black students, see drinking as inseparable from sex. And part of that is produced by sexual shame. So, there was one young woman who said to us that she drank before she would hook up because it was like Novocaine before the dentist, that otherwise she couldn't imagine getting naked with someone she didn't know. And I think it felt to her, for other reasons, like that was the only way to connect with somebody. So, so much to say about alcohol, but I think, if you've ever been to a bar, you might have noticed that like the combination of drinking and sex, it's not something that only college kids do, right? Like some of us may not have been conceived were it not for the combination of alcohol and sex. And so I think that the adult exoticization of that behavior is part of the problem. The undergraduates who advised us on this project, who were amazing. I mean, shout out to them. They met with us every Monday morning at 8 a.m. for the direction of the data collection and to help us with the questionnaires and help us recruit students. And when we started to have findings and to share them back with them, one of the things that got the most snaps, and for people who are not on campus now, when snaps is the equivalent of like, yes, you got it. was when we said just what you said, Betsy, that students don't drink and then by mistake have sex. Frequently they drink in order to have sex. And so I think acknowledging that as a normal, socially organized practice that is for a lot of students the way they have fun is part of the conversation. And the other part of the conversation is surfacing that heavy drinking puts people at risk for assaulting people, right? So I think that there's been so much like, don't drink too much because you might get assaulted. And the message really needs to be, don't drink so much because, as the kids say, you're thinking with your little head, not your big one. You're not paying attention to anything other than how you're going to feel. And so you're not acting with your best self. The other thing that I would be remiss to leave out is that because there's this frequently unrecognized racialized dimension of drinking, if all of the prevention work is focused around the connection between alcohol and assault, then what we're doing is we're underserving people who don't drink very much, right? So we're taking the experience, which is primarily a white student's experience, we're taking it to be universal, and then we're underserving students who would be much more likely to be assaulted in an intimate partner relationship or through those people touching their body when they don't want them to.
Another revelation in the book is the very high rate of sexual assault that queer students experience. Can you talk to us a little bit about what you see as some of the, what are some of the ways that LGBTQ students engage in sexual citizenship? How does sexual geography affect this student population in particular? Talk to us a little bit about that, please.
So, I mean, queer assault, like all assault, is not just one thing. One thing that came through very strongly for us is the vulnerability that's produced by a lack of social recognition for gender and sexual diversity. So one student who went by they, them pronouns, grew up in the Midwest, family not super supportive of their gender identity. And a summer theater program before college was the first queer space that they had been in. And it was magical, right? It was finally a place that they felt at home. And it was also a place that they were assaulted. They were assaulted by an older man who was gay and very comfortable with his sexuality and seemed to know what to do and gave them alcohol, and they didn't know what to do. And they were put in a situation in which there was a disparity of age, of intoxication, of power, of sexual self-knowledge. And that situation was not inevitable. If they had grown up in a school that had a gay-straight alliance or been in a family that recognized their emerging gender identity, they might not have been so hungry for recognition. They might not have been so hungry. I mean, it's still wonderful to seek out affirming spaces. So they might still have gone to that summer theater program, but they might have been less vulnerable. So part of, I think, the production of queer assault is the social disadvantage that sexual and gender minorities face, not just on campus, but everywhere in society. So, and then there are other stories that emerge about what produces queer assault. In some ways, it's it's a smaller dating pool because there are just a smaller number of students, and the community for many sexual and gender minority students coming to college, and particularly coming to college at a place like Columbia, which has historically been a very queer-friendly institution, at least as far as Ivy League institutions go. It feels like, arriving in Oz, right? It's like they're finally in a place where they can find a community. And that makes them very committed to the well-being of that community in ways that sometimes put their own well-being at risk. So for example, Adam, he tried Grindr and he got tired of guys who would just have sex with him and then ghost him. He really wanted a relationship. And so he found a relationship, and he loved his boyfriend, and they had friends in common, and it felt like an important part of his college project was having a stable relationship. And he described how one night his boyfriend came home and, in his words, basically raped him. And was very forceful, didn't ask for consent. He didn't enjoy it. And yet he didn't want to, report him. He didn't even confront him, right? Because he didn't want to make a rupture in the social fabric that had become for him an alternative family. And so I think one of the things that was so heartbreaking about the stories of queer assault was the ways in which it was affiliation and commitment to that community that produced, if not vulnerability to the assault, then certainly sort of trapped people in not being able to seek any kind of social resolution. So and one thing that I would say more generally, other than like read the book, is that in the book, we don't have a queer chapter and a chapter on Black students, but instead in the way that students' lives are threaded together on campus, we examine queerness and racial and ethnic inequality throughout the whole book, because that is, I think, for most students, I think this is probably as true at Princeton as it was at Columbia, these campuses are the most diverse institution that they will ever be a part of, right? They come from racially and economically segregated neighborhoods, and they are likely to go back out into racially and economically segregated workplaces. And so it's a moment of encounter with difference that is profoundly complicated in ways that go beyond the sexual. And that's one of the things that we also talk a lot about in the book.
I'd like to think a little bit about the role of institutions here, Jennifer. You just mentioned these institutions very deliberately create this kind of diversity and value the difference and what happens on campus by virtue of bringing the different people together. That's a very mindful project of universities these days. What are some of the ways that universities could think about broadening their agenda around preventing sexual assault beyond just sort of the consent education that we've already talked about? And it would be helpful if you could talk to us a little bit about the ways Columbia has started to move in this direction. And then if you might help us think a little bit about what Princeton might do.
So, I think I would be remiss in not starting out by expressing my enormous gratitude to Columbia for funding this giant project. They are not any more than I think Princeton is in the practice of responding to faculty requests by giving them $2 million, right? So like that was insane. And it allowed us to put together a sort of moonshot level project with researchers from many different disciplines and a big team. And we're like, okay, let's throw the best research design at this problem that we can. So I think the willingness, and they took a risk, right? It was a lot of money, but so we had not just generous funding, but a lot of sort of institutional and administrative support. When we were on page 6 of the Post, the comms team was in there helping us figure that out. And total scientific independence. So like exactly what you would want. And, this is not my first rodeo. And so I know you can't just hand someone a binder and say, do this and have them do that, right? That's not how big institutions change. And so from the beginning, we took what's called a community-based participatory research approach, where instead of issuing recommendations to the university, from the beginning, we were in conversation with them about what we were finding and what it might mean. And what that enabled us to do was to build sort of unlikely alliances with people who shape the undergraduate experience outside of the people who do prevention. So certainly the people who do sort of the classic prevention work were at the table and in conversation with us, but I think maybe our best friend ended up being the person who's in charge of housing and dining. Sort of, he just shapes the whole physical experience. He's the vice president for facilities. And he had never thought about sexual assault prevention as part of his mission. I think he did already understand that mental health and well-being was part of his mission, because when the students talked to us about a thing that cheered them up, they mentioned the cafeteria workers knowing their name. And Scott, he's a terrific leader, and I think that he's imbued a sense of mission in his whole team, so that they see caring for students, you know, everyone from the janitors to the cafeteria workers to the people in the housing office. They're not just doing their job in like providing food, they're providing a home. So, but Scott had never thought about sexual assault prevention as his job. And yet, like, it was so exciting to see the light bulb go off. And he's like, oh, I can be an ally here. And like, actually, he's a person with a lot of power. And so one of the changes that Columbia made, not just in response to our findings, but I think in response to a broader concern with well-being and substance use, was to keep one of the cafeterias open all night. And so again, that goes back to the sexual geography. So when you have drunk students at 2 a.m., now they have another place to go to eat French fries, right? You can swipe in without having to buy anything. It's a warm, well-lit, kind of cozy space. You can play pool. The Columbia dorms, unlike the Princeton dorms, are not quite so lavishly featuring lounge space. And so it was a game changer in terms of using his authority to literally remake the space on campus. Another example was, well, Columbia's lawns don't quite equal Princeton's. We still have our lawns and we're proud of them. And the lawn contingency had been very opposed to student activities on the lawns because the campus is smaller, and so they take a lot of wear and tear. And we have really argued that we should be making maximum use of every ounce, every inch of space that we have to enable sort of socializing. And so we felt like it was a big win to see during orientation a couple of years after we did the field work, a big carnival, including like the thing that is maybe worst for the grass ever, which is a bouncy castle. So there were all of these carnival games smushing down the grass. And we were like, you know, score 1 for people, 0 for grass. So I think like thinking in that way about how people, whether it's facilities or financial aid or the curriculum, like there are so many opportunities to remake campus in ways that are more welcoming. I mean, fundamentally, it's about integrating mental health, diversity, equity, and inclusion, substance use, and sexual assault prevention. Not so like the sexual assault prevention people are more burdened by having to do all those things, but creating opportunities across all those areas of prevention to collaborate, but also bringing in new allies, people who didn't understand that they have the power to remake campus life.
I love that very optimistic view of making this a holistic effort across campus that's not just about preventing sexual assault, but that's about really promoting all kinds of wellness for students. Princeton, for the last couple of years, has done this great campaign called the Hidden Chaplain campaign, where they ask students to identify the people on campus, and it's the dining hall workers, or the person who empties the trash bin in your dorm room, that these people who are really significant and important figures in students' lives, and kind of elevating them and giving them the recognition that they deserve. And I think that that's the same kind of thing that you're talking about. I know that there are lots of great questions that people have submitted, so I want to open it up for Q&A. I want to ask you just one more question, Jennifer. You just ended by talking about allies and the importance of allies. And I think that one of Princeton's greatest assets, of course, is its alumni. And do you have any quick reflections on how alumni can be allies in this effort to make campus safer and to prevent sexual assault?
Yes, call your elected official and demand comprehensive sexuality education in K through 12. I mean, one of the papers from the larger project found that women who'd had sex ed that included teaching them how to say no to sex they didn't want to have, which is not abstinence only sex education, it's just good sex education, were half as likely to be raped in college. And another paper that I've written shows why good sex ed can teach people not to perpetrate, which is obviously, it's not just about refusal skills, it's about reducing perpetration. So use your power as alums to advance policy change. There is a crazy patchwork in America where rich kids and kids in private school and kids in certain urban schools get sex ed and the rest don't. We've just decided that we're going to live with that inequality in the way that we live with all kinds of terrible inequalities. So I think that that policy change, you know, half as many women being raped, that's herd immunity, right? And in the same, that's as effective as a flu shot. And it's not going to prevent all the assaults, but it would prevent a lot of them. So that really is, I think, the low hanging fruit. And then, you know, parents, talk to your kids. So I think you can't expect young people to feel good saying no or hearing no if they've never been given the space to say yes. I am personally a proponent of the sleepover for older adolescents who are in a committed relationship, because I think that there's no more powerful way that you can acknowledge your child's sexual citizenship than to say, you know what, if you're in a relationship with someone and you care about each other, sure, like better under my roof than in the back of a car. So I think that through our parenting and through modeling that in communities, we can make an I think there's an opportunity for enormous cultural impact.
That's the Dutch model. That's a great model.
Yeah.
Also, get the book, read the book. We will drop some information into the chat about where you can find the book. You can find it at independent bookstores. If you already have the book or you purchase the book and you'd like it to be signed by Professor Hirsch, she has a way to send you a book plate that's already signed. So we'll put that in the chat for you. And if you have questions, please do go ahead and put them into the Q&A. And I'm going to turn things over to Mary at this point to curate some of our questions.
Sure. Hi, like they said, I'm Mary. I'm a student of both Professor Hirsch and Professor Armstrong, and it's been such a pleasure to listen to both of you this afternoon. And there are a lot of really fantastic questions, so please bear with me. I'm going to try and get through as many of them as we can, but we might not have time for everybody's. But one of my favorite ones that was asked, and I think especially pertinent given the situation with COVID-19, Professor Hirsch, is how do you think our new standards of social space and social distancing will change sexual geographies for campus students, especially as we don't really know what those spaces will look like when we return?
So I have an op-ed that I just submitted somewhere about this. I think that fear-based public health doesn't work. If you think about what has worked to get people to wear masks, it's a sense of commitment to the common good. And so I think telling students, don't have sex because you're going to transmit COVID, like, sex is not a health behavior, it's a social behavior. And they're going to have sex. I think that we need to help them think about what in HIV and sort of more broadly in public health, we think about as harm reduction, about how they can engage in sexual interactions in a way that reduces the spread of COVID, because for a lot of young people, it's not that they don't come to college to sit in seminar with me, but they come for each other, right? And a big part of that, a big part of the college project is the sexual project.
Very true. And then another great question that somebody asked, which is especially relevant for all of you alumni out there, is that truly sexual assault is not just a problem for college students, and oftentimes it's perpetrated on college campuses, but what kind of advice do you have for people, especially young alumni who have maybe moved to a city, or like you said, things happen at bars all the time? How can they take this knowledge and the research that you've done and apply it to their own situations?
I've been so moved by the number of people of all ages, including some of the journalists we've spoken with, who have said that reading the book led them to reflect back on experiences that they've had, in some ways with some discomfort. And so I think that, you know, reading Sexual Citizens and then really thinking about what is your sexual project. There is no right sexual project. respect, as long as it's one that encounters other people with respect. But being clear about what is the kind of sex that you want to have and what is the kind of sex that you don't want to have is protective. It's not 100% protective, because you go out there in the world and there's still other people who may be less clear about their sexual project or maybe intentionally seeking to harm you. But most sex happens between people who know each other. And so really starting with that clarity is important.
I think that's especially relevant and something that I was thinking about when you were talking about somebody who had been assaulted by their intimate partner, and how he felt sort of afraid to talk to that person. I'm wondering if you think reporting is always necessary and the right thing to do, and how forms of alternative justice within these issues can be a part of the discussion of this issue.
So I always, I want to stay in my lane as a social scientist and not a lawyer, and be very clear that our work was not, as much as it was not an evaluation of the prevention program, it was also not an evaluation of the reporting and adjudication system. And what we learned from survivors is that they want to feel seen, they want an apology, and they want there to be a system for the people who hurt them to learn to do better. And so I think that many campuses are missing that system, right? And so, if you get in a traffic accident, you get, if you get enough accidents, you get sent to driving school, right? And so there is no parallel system to help people who are repeatedly harming each other through sex learn to do better. And I think that, the awkwardness of calling someone out or calling them in comes from how awkward that feels. And also, like, why should it be on survivors to have to educate people who hurt them? But I think there does need to be some sort of system, some sort of institutional resource where people can learn how to have sex better. I mean, honestly, there are just a lot of men who are not very good at sex. They're not that concerned with women's pleasure either. And so they need to, that would be a good place to start. Like, learn to get better at sex. Who wouldn't want to do that? But also, like, P.S., it could help you not rape somebody.
Along those lines, I definitely, in going to your talks before, and a question that somebody had is, how can we respond to people, and how do you respond to people that want to shift the burden from survivors and from women who are vulnerable to other populations who are more often committing these crimes? I think that there's a lot of fatigue in saying that somebody who is more vulnerable to be assaulted shouldn't be the one who's preventing that horrific act from taking place.
Right, in the same way that, like, it's the job of white people to stop racism. So, yeah, I mean, I think that that's why it's so important for men. I mean, not all assaulters are men, right? In the book, we tell a lot of stories of different people of different genders, but most assaults are committed by men and experienced by women. And so we need men to lead on this. I mean, I'm very proud of my older son, who's a peer health educator, and has worked in the Chicago high schools teaching consent education to high school kids. I think that the more men who step up on this issue, the better. And a real silence that we saw in the book was dads. So many, like, again and again, students talked about relying on their mothers when they'd experienced an assault. And it seemed like men were not doing any of the emotional labor around helping students who have experienced an assault or socializing them to be able to have sex with other people without harming them. So I think that, yeah, men need to lead on this issue because they're the ones who are causing the most harm.
Sure. And a related to question to that somebody asked, and I mean, I don't have experience with this, but I'm sure as a parent, as a mother, as somebody who's working with young women, how do you teach your children sexual positivity and that sex is great and can be pleasurable but also that the reality of sexual assault is real and something that they need to consider without using scare tactics and pushing them away from the idea that sex is something great, and if you are able to have it in a healthy way, then that's fantastic.
I mean, all of those messages are like, luckily we have 18 years with them before they launch, right? So if you have young children, like the first time you see them masturbating, don't freak out, right? They masturbate in utero, like there's nothing else to do in there, right? So don't be shaming about sex. You know, if you never say the words penis and vulva, then it suggests that like those are unspeakably shameful. So you say elbow, neck, say penis, vulva, like name body parts. As they get older, as I said, I'm a fan of the sleepover, but I think making sure that your children have private time with their doctors, as is recommended by people in adolescent medicine, making sure they have access to sexual and reproductive health services when they want them. There are all kinds of ways that you can give. So it's not only things that you say, it's also things that you do. And then, any movie that you watch about adolescence, whether it's Booksmart or Blockers, or, when we've all been trapped at home together, I made my kids watch both Grease and Risky Business. Like pretty much every movie about high school is about the quest for sexual experience. So those are all texts for discussion, right? If you don't want to talk with your kid about their own life, you could talk about what the heck was he doing running a prostitution ring out of his parents' house. So there's a lot of things that I think through conversation ways that you can convey values. And I think, I come to this with a lot of humility. Like we use driving as a metaphor, but I have refused to teach my kids to drive because I find it terrifying. I'm like, that's your dad. I'm not doing that. And when my younger son left the house for his first driving lesson, I literally said to him, don't crash, right? So like, what a useless fear-based message, right? Like the only thing I conveyed to him was that I don't trust him behind the wheel. So I think that it's hard to watch your kids grow up. And I think we have to check our fears and think about what our aspirations are for them. Our aspirations are to see them settled with someone they love. And part of that is likely to be sex. And so sex positivity is part of launching them into the adulthood that we aspire to for them.
A relevant question to that is that there are certainly some parents who just don't feel comfortable discussing sex with their children. And then a lot of times, if those places that the child grew up doesn't have comprehensive sexuality education in a K through 12 situation, then that student is coming to college without any prior knowledge. Where do you think the priority should be in K through 12 sex education, especially in places that are not welcoming to the idea of teaching students in 5th grade about sex?
Well, I mean, what you get in 5th grade is not sex. You get a message like, don't grab, use your words, right? And you get messages about respecting other people's body space. So they're not talking, I mean, I developed the sex ed curriculum for my son's K through 8 school. So I say this with some level of expertise. They're not talking about intercourse in 5th grade. They're giving age-appropriate messages about bodily autonomy that protect young people by making them less vulnerable to being sexually abused by adults, and also serve as building blocks for later age-appropriate messages around sex. And it's true, like you could do everything right with your own kid, and then you send them out into the world and they're in college with people who come from an abstinence-only state or from a family where there's a lot of fear and shame around sexuality. And so that's a reason that we have to do even better as parents. And I think that, no freshman is going to raise their hand and sign up for a class for the remedial sex ed class. And so I think that that's where there's great online sex education that already exists. Like no school needs to reinvent the wheel in terms of creating sex positive, funny, on point videos that you can watch on your phone when no one's watching. So like there's a lot of content out there. And I think that making sure that all freshmen have access to that to sort of level the playing field is important. But I think also pushing, like, until we have national sex education standards, we're going to repeat this inequality. We're like, even if New York passes legislation to advance comprehensive sexuality education, there's still going to be Alabama and Mississippi. I mean, excitingly, sex ed was on the policy agenda this session in Tennessee, Georgia, and another in Kentucky. So this is not like, not all like a blue state thing. Colorado last session passed comprehensive sexuality education. So this is something like, I think making the connection between sexual assault prevention and comprehensive sex ed is one way that we can maybe lower the partisan temperature around this, because nobody wants their kid to mistakenly assault someone. And so, and we don't teach driving after people get their licenses. And so I think there's lots of ways in which there's, this is a moment in this Me Too moment where I think we could make progress. And not everyone goes to college, remember? And so comprehensive sex ed is also workforce development, right? Like clicking through a set of PowerPoint slides is not going to teach anybody respectful interpersonal interactions at work. And so I think, we need employers to get behind this as a way of reducing liability and making sure that they'll have workers who know how to interact with each other without harassing each other.
Going off what you have said about different laws that are being put in place in different places, I wonder what your perception and thoughts about the new Title IX reforms that have been released by this this administration very recently. What are the effect of those on students, and how do you think that universities can be in compliance with them and also be taking the safety of their students as the utmost importance?
I don't have a lot to say about the new regulations because, again, I think our focus is much more really on prevention. I have noticed that they don't seem to say very much about prevention. And so it's been, and the survivor student-led organizations, whether it's Know Your Nine or End Rape on Campus, are out front leading the critique of DeVos and the new regulations. I think the only thing that I would add to that is that it's frustrating knowing, that maybe only 5% of assaults are reported. Like obviously adjudication should be fair and not do additional harm. And we have failed at that, but we have to remember the other 95% of assaults and do more to prevent them.
And speaking of prevention, the work that you've done at Columbia is really fantastic, but I'm wondering in what ways it is that it isn't applicable to the specific setting of Princeton or, for example, other schools that are very different from the Ivy League. And is it worth it for those schools to really be doing their own research on their own campuses? I think it's unreasonable to think that every school could do a $2 million study, but is it necessary to do some sort of specific research?
I mean, I think I would lose my card as an academic if I didn't say more research is needed, right? But the questions that we generate in Sexual Citizens about what are student sexual projects and what are the institutionally specific sexual geographies, how do students think about sexual citizenship? I think that those are questions that are relevant in every campus. So obviously, and some of those can be answered by students. It's not like you need a researcher. So I think that just creating a space in which students can reflect on and clarify their sexual projects could be useful on any campus. And then obviously the sexual geography of Princeton is very distinct. Doesn't have the same dating pool and nightlife scene that New York does. So it's different in many ways. And we would love to do some comparative research. I think that given how interested we are in how context shapes students' experiences, there wasn't any variation in the context, right? Other than like crossing Broadway and noticing how different Barnard is than Columbia. And so I think that there are opportunities for comparative research, and that it's important to remember that most college students in America live at home with their parents or their kids because they go to community college. And so for them, the sexual citizenship question is, how is their sexual citizenship regulated by their parents or by the fact that they have their own children? So I think that there are entirely different questions that you might ask about community college, but that this optic is still a useful optic as a starting point.
And another Princeton-specific question that somebody had brought up the protests, I believe they were in the 80s and 90s at Princeton, where male members of eating clubs stood on the street yelling, "We can rape whoever we want," in the face of the protesters, which is a horrifying history for the university to claim. And the person was wondering how you understood this culture to have changed or have not changed in your past year at Princeton, and is the university doing enough to address these issues?
I mean, you know, I had students like you in my class, so I'm not sure that you're like a random sample of Princeton undergraduates. I mean, I will never forget standing outside of TI with a movie projector and a date rape movie in, I think, 1986, you know, before we went in to show that film. And obviously, like, showing that film, I think probably it had no impact other than that was the one time I was in TI. But it's hard for me to say how the Princeton social environment has really changed. I know that Terrace is as queer now as it was when I was there. And I think that America, you know, certainly elite institutions are more diverse than they were. The Third World Center is no longer called the Third World Center, for example. And so I think as whiteness becomes slightly decentered, I think that the social practices may change a little bit. But I would say, you know, stay tuned. I'll have to get reports from my son when he's on campus. I don't feel like I can't fully answer that question now.
Another sort of unrelated question is, were there the same types of trends for students of, not necessarily just Black students, but students of color in general on Columbia's campus, for example, Asian students or Native American students?
So I think that that's, you know, there's work that we do in the book, and then there's work that we leave for subsequent scholars to do. So there's much more that could be said. You know, obviously, people of color are not an undifferentiated blob. There's a lot of important heterogeneity. And so while we observed some very distinct things about Blackness, and we never changed, like when students were Black and that was analytically important, they are described as such. But I think that we didn't, with the time that we had and the sample that we could build, there's much more that could be said about the diversity of experiences of students of color, including Native American and Indigenous students. I think similarly, even within Asian students, there's enormous diversity, you know, so, and particularly on the Columbia campus where there really are a lot of Asian students. So I think that lumping students together even as Asian erases important heterogeneity. And we don't really say anything at all in the book about disability, which is, I think, the biggest silence. And, you know, I prefer to see that as an opportunity for the next generation of scholars, because we know that there are higher rates of assault among students with disabilities, both visible and invisible. And so I think that that is, it's actually, I would put that among the most urgent questions to look at in the campus context is looking at sexual assault and disability.
And along those lines, in future research and also in your research, what kind of ethical considerations did you all have to do, especially when you had younger researchers accompanying students to parties or in buses? Did they have some sort of exemption from mandatory reporting if they heard about assaults? And what kind of things were they expected to do, for example, if they were at a bar or at a party and they saw something, for example, drug use that seemed quite unsafe, or somebody who looked like they were in danger? What kind of ethical dilemmas, for example, were those researchers in?
Many ethical dilemmas, and actually there's a ethics appendix in the book that sort of lays out all of the challenges that we saw and how we contended with them. We did, this was one of the ways that the university was so supportive, secure an exemption from mandated reporting. Because ordinarily, as faculty or employees of the university, we would be required to report any incidents of gender-based misconduct that we learned about. And obviously, that would make it impossible to do the data collection. And so the university had to contract to an outside law firm, a risk analysis before they could, I mean, it's because it's a big deal because they were potentially exposing themselves to another lawsuit by doing that. And so they again, I think that's just part of like the big risk that they took with us. We trained our, everybody we interviewed, we made sure that they had access to a list of supported resources. We did have an emergency protocol in place so that if we ever spoke with a student and we felt like they were in imminent danger of harming themselves, we had a clinician on call who could help us figure out how to triage. We actually, the only time we ended up calling the clinician on call was when one of the research team, was so distraught from doing the interview that we needed someone to talk with. I remember walking up Amsterdam Avenue sobbing after doing one of the interviews because I was so shook by this young woman who had developed a substance use addiction and had been trafficked and told a story of really extreme suffering. And I said, well, didn't your parents notice? And she said, well, my grades were good and I was playing sports. And that just like, it got me right here because you want to think that you know that your kid is okay. And she had managed to present a facade of being okay to her parents when she was so not. So there were a lot of complicated ethical challenges, and it was very hard on the team. I mean, I think that holding these stories over the course of the 18 months, Shamus and we started every meeting with a mental health check-in with our staff just to see how they were doing because it was a lot for them, and they were extraordinary.
Kudos to them and to you all. It really, it's difficult to do that work for sure. And this is sort of a common question that I think a lot of people have, and is part of the public discourse, is that locker room talk seems like it's sort of inevitable, especially because of the sexual geography and the insular space in which it occurs. And this person is wondering how you can address this part of the problem with sexual assault, telling boys not to, quote unquote, be boys, or telling them to be respectful of women is all and good. But if they're all sort of cajoled into this group, how do you address that when you're not there to put a stop to it, or someone isn't?
I mean, there are interventions that train coaches. And I think, I'm not going to ever be in someone's locker room, right? But the coaches are there, and I think the coaches set the tone. And so it's called Coaching Boys into Men. And I think it's one of the few interventions at the middle and high school level that's shown some promise. I think that, all of the institutions that touch young children's lives as on their passage to adulthood, whether it's youth sporting or religious institutions or cultural and arts institutions or camping, all those things that we used to have, pre-corona times and hope that we will have again, all of them have a role to play in preventing sexual assault. And so I think that that's a perfect lead into just reminding people that it's not just schools, it's schools and families and faith-based institutions, that everybody really can be part of this, of solving this problem.
And I actually think that's going to be our last question because it's almost 4:30. But I personally wanted to say thank you so much for enlightening me. And I always learn more every time we talk. And so it was a delight. Thanks.
And on behalf of the PA3, I'd like to thank all of you for sharing this really important information and everything that you've done in creating this book with your co-author, Jennifer. I can't wait to read it. Thank you very much, everyone, for being here.
Thank you for the great questions, for creating this space, for showing up, for being open to hearing some of the pain, but also I think that to looking to the future with some optimism. I really feel like we can do so much better on this problem, and so I appreciate everyone's engagement with our work and look forward to being in touch with our readers.
I'll just jump in and say thank you to Jennifer as well, and thank you to everyone who showed up this afternoon. I think one of the hardest parts of these virtual events is that there's really no way for the audience to share their appreciation and enthusiasm for the speaker. but I'm sure that you all join me in thanking the Princeton Area Alumni Association for sponsoring this, thanking Mary for her excellent help with the Q&A, and most of all, thanking Jennifer, not only for her time this afternoon, but for this really important and innovative work that I think is both groundbreaking and game-changing. Thanks, Jennifer.
So much. Bye.
Bye, everybody. Oh, so I think now it's just us?
I'm not sure because I see
There are still
participants.
16 participants.
Okay.
Yeah. It's unclear to me if we're still broadcasting, so just don't tell any secrets. Well, this was great. Thank you all so much. What a great conversation. Well done with the questions. So appreciate.
Oh, thank you. Jennifer, you and Elizabeth did an amazing job with the interview.
Well, we go way back.
We do. It was great, Jennifer. Thank you. Mary, I don't know, were you able to capture the questions?
Yeah, so I took screenshots of the actual, like the questions that they asked specifically. And then also I, on the document that had all of our bios on it, have more of like the questions that how I phrase them. So some of them might be repeats because at the end when I was trying to ask questions and new ones were coming in kind of at the same time, but generally I can, I'll put those all connected at the bottom of the doc so you can have access to them. That works.
And I also get the recording has a text file.
Oh, it does. Okay.
Yeah. So
awesome.
I think it might be gobbledygook. I'm not really sure what form it's in, but I think all the content is in there.
Yeah, I would just be careful, or at least because some of the questions were not asked anonymously.
Right.
And some of them were.
Okay.
There were a few questions in the chat.
Yeah, I
Elizabeth worked
copied
on
and pasted some of the questions in the chat into the Google document.
Great.
Yeah. And we did put all the book info in the chat at some point, Jennifer. So hopefully people, and somebody, at least one person was, so you may get some follow-up.
Great. I love it. Okay.
Yeah, awesome.
Well, thank you so much.
Thank you
Thank you.
to Simon and Columbia for the tech support here. It was great.
Yeah, great. So appreciate. And hopefully I'll see you all on campus before too long.
Yes. Oh, hopefully.
Yeah.
Thank you. Nice to meet you all virtually.
Yeah.
Yes,
Okay.
thank you. Thanks, Diane. Bye, everybody. Have a good weekend.
Bye.
Bye-bye.